Well, thank you everyone for joining tonight. I'm going to ask DRNY's Executive Director, Tim Clune, to welcome everyone and start off the evening. Thank you so much, Tim. Take it away.
Thanks, Katrin. It's great to be here. So I want to welcome all of you for joining us tonight as we present and discuss the report, Systems in Crisis, Identifying Critical Issues in Response to Mental Health Crisis Calls. So this was a joint effort between DRNY and the Mental Health Recovery Research and NADAL Racial Justice Research Labs at the John Jay College of Criminal Justice. So everyone remembers, after we had seen the video of Daniel Prude when it was released, and then the specifics about the call from his brother, this was seen and heard around New York State and the country. And as a result, we knew that we had to take some type of action. We had to address the continuing critical issue that has been leaving far too many of our brothers and sisters, wives, mothers, husbands, and fathers without the care they need when they are in distress. And far too often, these calls end like Joe Prude's did, with the death of a family member. There was no assistance provided for his brother. Daniel was restrained, he was hooded, he asphyxiated at a time that he was most vulnerable and that he was most at a point in his life that he needed help. This senseless loss of life must stop. We've started the serious work with the release of this report, but we now must continue that work and begin the conversations about making real change. It is our hope that this report will be the catalyst for that change in response to our families and communities when they do reach out for help during a mental health crisis. I would like to just take a moment to thank Mark Fliedner, Jennifer Monti, Denise Elliott, and Letitia Fichion from DRNY for their stellar efforts on this project. At this point, I would like to turn this over to Dr. Philip Llanos and Dr. Kevin Nadal to give us an overview of the report. Take it away. Thank you, doctors.
Okay, I don't think we coordinated about who would speak first. So Kevin, would you like to go or should I go? Okay, so I just have a couple of things that I wrote down that I think could give you a little bit of a preview of the report and hopefully get you interested in reading it. So what I wrote is that as the nation reckons with the potentially deadly effects of racial bias in policing in the wake of the killing of George Floyd, and obviously the trial of his killer is underway right now. And as the nation considers a range of reforms to the way policing is conducted, this report argues that the way policing intersects with people experiencing a mental health crisis needs to be fundamentally reconsidered. Given compelling evidence that people with mental health conditions, and especially those who are Black, Indigenous, or people of color, are at increased risk of injury, death, and traumatic experience when interacting with police, and proceeding from the assumption that people experiencing mental health crises are entitled to human rights and dignity, we argue that non-police crisis intervention approaches should be considered. We also place the intersection of race and mental health crisis at the forefront of the discussion, given the increased risk of injury, death, and traumatic experience that I cited. And we argue that whatever alternative approaches are developed need to be created in collaboration with affected local communities, including people with mental health conditions. So we recommend that alternatives developed should not just replace the police with coercive mental health treatment, but we recommend that true alternatives proceed from an intersectional, anti-stigma, and anti-racist perspective that acknowledges mental health problems are part of the human experience and can occur to anyone. So community members, local communities that consider what alternatives should take place of police responses should consider what they would want to happen if they or their loved ones were to experience a mental health crisis. That's just a small part of what we're talking about, and I'll let Kevin also speak a bit, and then we'll, I guess, go to the panel.
Sure. So I'm sitting on the panels. I don't have to say much at this moment, but I just want to acknowledge DRNY and Mark Fleidner. Mark has been such a good friend of the family for years now. And so Mark initially approached me as we've known each other for a while and talked about a little bit about his work and the reason for this report. And so my work at John Jay has focused specifically on racial justice, particularly through the lens of intersectionalities, understanding the ways historically marginalized groups have been affected not just by the criminal justice system, but by society in general. And so understanding the multi-layered ways of systemic oppression and how that then affects everyone in their everyday lives. And so I invited Dr. Llanos to join the project as his work focuses on stigma, and particularly stigma of mentally ill people. And I think we've assembled a very nice team where we have different perspectives of researchers, scholars, students, activists, community organizers who are able to contribute to this really wonderful report that talks about all of the different ways that mental health and race and other intersectional identities are affected when people come into contact with police. I think it's something that's really important now, not just with the Derek Chauvin case happening right now in Minneapolis, but also as conversations about mental health are continuing to be had in mainstream media. I think now is the time to have this conversation. So I'm really honored to be part of this. So thank you so much.
Thank you, Kevin, and to everyone for bringing us here together tonight. So my name is Jeff Coots. I'm going to be helping to facilitate the panel tonight. So thank you for joining us. I serve as the director of the From Punishment to Public Health initiative at John Jay College, and much of our focus is how we can improve outcomes and enhance collaborations at the intersections of public health and public safety. And so I was very pleased to hear about this report being published and honored to be helping out with this event and serving to moderate this panel. So as you heard Kevin say, we have a great group of speakers tonight to talk about a range of different perspectives on these issues. So we'll be hearing from Mark Fleidner and Erica Marie Molina from DRNY. And then we also have Therese Todd, Rukia King, and Kevin Nadal joining us again from John Jay College of Criminal Justice. And so we're going to try to keep it as conversational as we can. We'll save some time for Q&A on the back end and welcome you to add your questions into the Q&A or the chat bar on the side there as we go along. So Mark, my first question is for you. And we heard a little bit about the motivations for the report and how your organization came to be working with several of the faculty members and doctoral students at John Jay. But help us understand a bit more kind of how DRNY was motivated to take on this issue of police encounters gone wrong, and how you hope that the report will help additional stakeholders better understand the best way forward as we seek reforms in this area.
Sure. I think picking up where my esteemed colleagues left off, first of all, we'd all just been through the summer where we saw, maybe for the first time in decades in this country, this collective voice for changing systems that have been fundamentally wrong from their inception. And so that then September comes, the Daniel Pruitt video is exposed to, as Tim said, New York State and the nation. And because DRNY's PAMI program, that's for protection and advocacy of individuals with mental illness, really stands uniquely at that intersection between mental health and the law, we felt not only compelled, but we felt obligated to be able to drive and inform the conversation about what do we do? How do we finally make sure that there is not another Daniel Pruitt? And we also were motivated to make sure that when we talk about harms that begin when police respond to acute mental health crisis calls, that we look at all the harms, not just the tragic potential for death or serious physical injury to the person that's supposed to be getting help, but also all of the other consequences that flow from a police-driven response, which include, of course, the potential for the person who's supposed to get help to be directed down a criminal lane where they're charged with offenses, a person to be taken into custody or transported under New York State's very specific mental hygiene law, which gives an enormous amount of power to police officers, and yet requires them to make evaluations that really are in the realm of clinical evaluations to be made by mental health professionals. So we wanted to really flesh that out, but we wanted to make sure that we did our homework first. And that's why I turned to my friend and former and colleague, Kevin Nadal, and his team and his colleagues at John Jay, not only because I'm a proud former John Jay professor, but also because I knew that they could help us to put this in a historical context, a national historical context, and where applicable, a New York State and city, even a historical context. And because we wanted to inform not only ourselves, but inform any other people that are deciding whether police should be, frankly, replaced as the primary driving force in such responses. If we were going to make that determination, we wanted to make sure that we could back it up and that was the appropriate determination. And in fact, the folks from John Jay provided us with exactly what we were looking for. And we believed collectively as a group working on this project, once that historical perspective was provided, that the case had been made for eliminating police as the driving force in these responses. But then, of course, we knew, and we gave ourselves basically 6 months to really come up with some guiding principles for all of the communities throughout New York State who are addressing this issue, to make decisions about what's the right alternative response model for them and their communities. And in doing that, we reached out to stakeholders and heard from them directly. We certainly applied all of the historical and cultural context that had been provided by our colleagues at John Jay, and our analysis of how the legal system comes into play when this happens. And we wanted it to be a document that was a valuable tool. We didn't want to say, here you go, this is the cookie cutter model that has worked in, for example, Eugene, Oregon, the much praised Cahoots model that replaces police. We wanted to say, no, these are the issues that you need to look at in determining what model is right for you and your communities, given the mental health professionals that you have in place, the various systems that are currently in control, and their willingness to buy into this process, and not ram a remedy down anybody's throat, but urge folks to reach out to every stakeholder who's got critical information to provide and engage them. Not only because, for obvious reasons, they're the ones who know what could and couldn't work for different reasons, but also because if communities don't do that, if policymakers in these communities don't do that, if they don't reach out to stakeholders, they will not begin the process of changing an entrenched system with the kind of buy-in, stakeholder buy-in that you need to make sure that it is truly heard, truly listened to, and really set up for success. Without doing that homework, we felt like there would be a failure. So our objective in creating this document was to provide people with a tool to begin the conversations in their communities, continue those conversations, checking back with the guiding principles, and never, perhaps most importantly, remember to put this critical decision in a historical context. And that includes the impact on the whole person, taking into consideration their culture, their past trauma, all of the things that come into play when somebody finds themselves in acute mental health crisis. I hope that begins to answer your question, Jeff.
That was great, Mark. Thank you. I think that's a great setup for the speakers that we have to follow. So I want to start, Therese, with you in thinking about how we can come to understand kind of the scale and scope of this problem, not just in New York City, New York State, but around the country. And so you have focused on how we've measured and analyzed these types of encounters in jurisdictions from around the country. I'm hoping you can help us understand what we know about these issues and where the gaps in the literature and gaps in our knowledge may hinder our policy conversations as we seek to move forward on this. Oh, you're still muted there, Therese.
Okay, I'm unmuted now. Thanks, Jeff. That's definitely an important question. So, what we know about persons with mental illness and their interactions with the criminal legal system is that they are quite overrepresented. So, in thinking about incarceration, there are extremely high rates of persons with mental illness incarcerated. So 37% of those in prison and 44% of those in jails had a diagnosed mental illness within just the last year. And when we think about, when it comes to interactions with the police, we're thinking about these really high impact outcomes. So arrest and use of force. A lot of research has looked at these outcomes in crisis encounters, and what it shows is that persons with mental illness are extremely more likely to interact with the police than those of the general public. And some findings have been mixed when it comes to thinking about arrest. So although some studies have found that individuals with mental illness are significantly more likely to be arrested, others haven't. But what has been consistent is that people with mental illness are more likely to be arrested for lower level offenses than the general public. And that's really important because that's what is the large majority of enforcement and crime. When we think about these incidents, that means that when people with mental illness are being arrested, it's not usually in the context of a severe crime or violent act, but in incidents of crimes for survival or crimes of poverty even. And it shows sort of this criminalization of mental illness. And reasons for this, why these individuals are being arrested as opposed to others who aren't, researchers talk about this idea of community intolerance for behavior or officers' beliefs about continued trouble or issues, and even access to hospitals and services that officers can take these individuals to. And I think really important to highlight here is that when these individuals are coming into contact with the police, it's usually not in the context of a crime or a violent behavior. And one of the most damaging stigmas of people with mental illness is that they are violent, dangerous, and unpredictable. But really, the research shows that people with severe mental illness are significantly more likely to be victimized than to perpetrate crime themselves. So people with schizophrenia are almost 15 times more likely to be victimized than commit a crime. And again, these individuals are more likely to experience victimization than the general public. In my own research, I found that in the Seattle Police Department, we had a data set from a 3-year period and looked at all of their crisis incidents. We found that the vast majority of those incidents couldn't be characterized by the responding officer as anything other than a mental health call. So that was 77% of crisis incidents. And in other cases, crime was still quite low. So I think about 7% of incidents involved a crime against a person and 5% involved a crime against society. And even in these cases, arrest isn't always happening. But we found that when arrest is happening, these individuals are very unlikely to be connected to services. And that's really important and a big issue. And so overall, in that data set, we found that arrest was pretty uncommon. It occurred in less than 10% of incidents. It still begs the question of why are police involved in the first place? If these incidents are not criminal in nature, they're responding to mental health calls, and people aren't getting injured. None of that is happening. Injury against officers is also very uncommon. So that's all really important to think about what's going on in these crisis incidents. And then when it comes to use of force, literature has also focused on individuals with mental illness and looking at the likelihood of them to experience force. And again, findings are mixed, but we do find that individuals with mental illness are significantly more likely in some studies to have force used against them and are a group disproportionately affected by fatal use of force. And so even though use of force is relatively a uncommon outcome in police encounters, it is extremely important because it has devastating consequences, as we all know. And rates of force involving people with mental illness really vary by department. There's no answer of, how often is this happening? And there's a huge range. But one thing that I think is really missing in the literature that we need to turn to more is the intersection of multiple identities when it comes to mental illness. So there is some literature that looks at race and mental health. And we know that Black individuals with mental illness are the most likely group to be killed by the police than compared to all other groups. But really interestingly, I was recently watching a video of Philip Atiba Goff, and he was talking about how years ago he went on a search looking for statistics regarding use of force, and he came up empty-handed. And what he realized is that I can't find it because the statistic doesn't exist. And he pointed out that we measure what we care about. And I would say still now we are falling really short when it comes to measuring use of force in crisis incidents, and particularly looking at the intersection of race in those encounters as well.
That is telling. Thank you. And a great transition, actually, to our next speaker, Rukia King, who we continue to highlight our wonderful students at John Jay. And so, Rukia, I'm hoping that you can share with us some of your work and perspective on the issues of policing within BIPOC communities in particular, and a bit about how you mentioned how the histories of racial trauma intersect with mental health in police encounters.
Yes, hi everyone. So I want to keep this as brief as possible, but I also want to highlight that this content is really important and also something that we should consider, whether we're talking about policing, mental health, or the intersections between the two. So I first want to start off with talking about the history of policing and communities of color. So initially, there's evidence that police departments were formed to uphold the institution of slavery. So police departments were used to intimidate and use violence to suppress slave rebellions and to kind of just keep this institution going. And many of those tactics included violence and intimidation against Black people. So after Reconstruction and abolition and Reconstruction, many of these police departments continued to terrorize Black communities, and some of them even supported white terrorist organizations such as the Ku Klux Klan. And today we see the same abhorrent treatment of Black people and other ethnically marginalized groups by police because these foundations of policing are based in white supremacy and racial bias. So there are so many disparities in the criminal justice system or the criminal injustice system, criminal legal system, whatever you want to call it. But there are so many disparities, and I'll just highlight a few. So first, neighborhoods with heavy concentrations of Black, Indigenous people of color experience an oversaturation of policing and police presence. We see that unarmed BIPOC are more likely to experience lethal police force than white Americans. Black suspects are more than twice as likely to be killed by police than more than any other ethnic group. And also this happens when there are no obvious circumstances that would there was no obvious reason that these circumstances would create a reason for these encounters to turn deadly or for excessive force to be used. Black, Indigenous people of color are overrepresented in the criminal justice system. They're also overrepresented in the juvenile justice system. And I can go on and on and on about these racial disparities, but I think it's important for us to talk about the consequences of these disparities. So we know that there are interactions between police and BIPOC that create a presence of this generational and collective racial trauma. So racial trauma is basically trauma that is a product of these race-based interactions situations that are racially oppressive, racially discriminatory, and make people feel bad about themselves because of the ethnic groups that they belong to. And this trauma is generational because it has been happening since slavery. It's been passed down from generation to generation to generation, but it's also collective because we see the entire society experiencing this trauma, the entire group experiencing this trauma, or the effects of this trauma. And so in terms of policing and the relationships between police, trauma does inform a lot of the relationships that these communities of color have with police. So we see that BIPOC tend to be more aware of police misconduct, and they tend to be more disturbed by police misconduct than their white counterparts. And we also see that BIPOC tend to be much more mistrustful of police than their white counterparts. And to add to that trauma of being exposed to policing, this whole history, there's also an excessive overrepresentation of police being brutally assaulting and brutalizing and murdering individuals who are identifying within the BIPOC group. So added to this trauma of, the history, being assaulted, being murdered, there's also this additional trauma where people are not receiving justice for what happens. So basically, police are rarely held accountable when they do murder people of color or they do assault people of color. And so this lack of justice contributes to an additive trauma and additional poor opinions of police. So now when we talk about mental health crises and police contact, there's an ostensible need to consider the intersectional framework in which these interactions occur. So intersectionality theory is the theory that suggests individuals experience oppression based on their various interlocking marginalized identities. We know that being a person of color is a marginalized identity, and we also know that experiencing mental illness is a marginalized identity. So therefore, it's important to consider intersectionality when discussing the experiences those with SMI have with police officers. So first, even before they are introduced to the criminal justice system, this disparity and bias happens in the mental health system, where Black people tend to be twice as likely to be diagnosed with severe mental illness as white people. So it makes sense that Black people are going to be more likely to encounter police when they have SMI, and those who experience SMI are more likely to be shot. Black people who experience SMI are more likely to be shot by police than their mentally ill counterparts. So while mental illness may be a mitigating factor in police interactions for white people, well, there's one study that suggests that, it is considered an aggravating factor for BIPOC. And this is all based on social scientific data because unfortunately there is no, I think as Therese said, there's no national database regarding use of force by police, but it is highly likely that police force and police brutality disproportionately affects BIPOC, particularly those who experience severe mental illness.
Whew, I'm tired just listening to that. That was a lot of information you covered very quickly there. Thank you. I'm going to save my question for the end, but I have a couple follow-up questions for you because I want to get to Kevin, Dr. Nadal here, who Kevin, when we spoke earlier in the week, and I always love organizing these panels because I learned so much just in helping to set them up and then get to listen to all the great speakers as you all do as well. And so you've spoken about the intersectionality of police encounters, as we heard Rukia discuss. And you've also focused particularly when it comes to race and LGBT perceptions in police response to mental health emergencies. So what do you see as some of the most persistent challenges in improving police responses in these contexts? And then also, where do we, if you can point us to some jurisdictions or perhaps even individuals who are in the police force that are getting this right, that we can hold up?
Sure. That second question is going to be a little harder, but the first question, in terms of what are some of the major barriers and challenges? I mean, one thing that I didn't mention in my introduction is not only am I a professor, but I've actually worked with the New York Police Department for about 8 years with their EDP program, their emotionally disturbed people program, which in of itself may be reflective of the types of biases that police officers have towards people with severe mental illness or with mental illness in general, that they call them EDPs or emotionally disturbed persons, which is quite dehumanizing in itself. And so when we, in my experience with police officers, we did trainings with recruits, with the hostage negotiation team, with the emergency services unit, and the first thing that is, for at least when I was working with them, is that they get such minimal training in working with people with mental illness. And so you have, as Therese had mentioned and others will mention, that a lot of their job is working with people with mental illness, but they're not adequately trained. So from the time that I was there, I left in 2016, and prior to that, recruits had 1 day of training. Hostage negotiation and emergency services unit, who are more advanced, senior, they get a couple of weeks of training, which is good for that. But the people who are most likely to be the first responders or the first people to interact with people with mental illness are these police officers who are on the ground, and they get very little training. The training that we had, I thought it was as effective as could be in a one-day training. We had improvisational actors paired with psychologists and paired with senior police officers who were able to talk about different disorders. The actors were able to demonstrate some of the symptoms in a very real and genuine way. And police officers were able to, or the recruits were able to practice some of those skill sets, but it was very minimal. On top of that, it was something that was really just reserved for that day, that they didn't talk about mental illness in any of their other types of trainings in the same ways that they also didn't talk about racism and sexism outside of trainings that may have addressed those on those 1 days. And so when we're thinking about reform, it's really important just for us to understand that it's a whole system that needs to be overhauled, that a culture of policing is embedded in white supremacy, in toxic masculinity, in heterosexism and transphobia. And that's something that really may be very difficult for people to change. As we know, culture is something that persists over time. Culture is something that affects groups and organizations, and it's very difficult to change those things. And when we're talking about the institution of law enforcement, as well as the institutions of the prison industrial complex, as well as just the criminal justice system in general, we know that it's very hard to change those things. But I think one of the things that we as community members and activists and organizers can do is to provide alternative recommendations or even alternative systems to counter what we know does not work. And so this past year, we've seen pushes for defund the police. And what people don't realize with that hashtag and that movement is that we're not saying to take away all of the funding from police, but rather to shift some of the funding that goes to police towards other programs that might be more equipped in doing so. And so in the report, we talk about some of those alternatives and what that might look like in different communities, because quite frankly, police aren't able to handle those things. So to your point, or your second question of who's actually doing the work, I mean, honestly, like I don't think there really are a lot of people who are doing this work. I mean, I think there are some examples of people like the Cahoots program in Oregon that is trying. I also think they're very different than New York City, and their population, as Dr. Llanos wrote about in the recent op-ed, does not reflect what the diversity of New York would be. And so if they're not trained in thinking about implicit bias or racial bias specifically, a Cahoots program might not be as effective in a place like New York, where people of color are among majority of the people that police officers are in contact with. So I do think that we still need to provide these recommendations or to push for alternative programs. But I also just think that it takes people in power, people who have the opportunities to change those systems, to listen to what the people want and listen to, what the facts say in terms of how effective some of these programs are, because we really can't afford for another person to be killed. The last piece I just want to share from a personal perspective is that, I've been in contact with family members who have lost people who have been killed by police for no reason. A case that didn't make quite the national news as much as Daniel Crude is the case of Angelo Quinto, a 30-year-old Filipino-American man in Antioch, California, whose family called the police because he was having what seems to have been some sort of psychological emergency crisis. They called 911. They dispatched police officers as well as EMS. Police officers showed up first. They found Angelo and his mom hugging on the floor, his mom embracing him very tightly. They threw him off of his mom onto the floor, onto his back, and knelt on his back and neck for 5 minutes. He went unconscious, bled out of his mouth, and at that point, his sister took a video of his lifeless body leaving their house. His last words to the police officers as they threw him onto the ground, according to his sister, was, "Please don't kill me." So people of color, people of historically marginalized groups, they know that police officers have the tensity, the propensity or the history of killing us. And perhaps they were the wrong people to show up at that moment, especially when he was more regulated. And that program, as well as other departments, they get these crisis intervention trainings, but it's not enough. And I used to be a believer in this as somebody who trained the police officers. I thought it would be effective. But after years of working with them, I see that it's not enough. There has to be a culture shift. There has to be a defunding and moving of resources to other programs and other alternatives. And that's the only way that we're really going to get, we're really going to save lives instead of people continuing getting killed by police officers.
Well, that is a tough act to follow, but we do have one more speaker who I'm very grateful for waiting to the end here, because I'm hoping that she can help us identify some of the reform efforts that are happening around the city and the state. So Erica Marie Molina is from DRNY, and we understand that DRNY has been working on intersectionality and anti-racism initiatives. And as part of that, you have been working with a task force at the state level to improve criminal justice systems response to community members with mental health challenges. And so I'm curious, working within that context of the task force structure, what you've learned through your advocacy in that space with some of the stakeholders in that space, and what you hope will come of the task force, and what recommendations we might be able to look out for as they come out.
Sure, Jeff. Thank you so much for that intro, and it certainly is a tough few acts to follow, so thank you. I did want to touch on the first thing you said, which is absolutely true, that Disability Rights New York, DRNY, whom I'm representing today, as well as Tim and Mark as well. What we're doing is trying our best as an agency to be active allies in this entire endeavor. We were not experiencing last summer's uprisings, the riots, the filmed violence against people of color and peaceful protesters. We weren't experiencing these things over the last year alone. We weren't experiencing them within a vacuum. And one of the things that we thought was incredibly important, especially during this time in this last year in 2020 in particular, everybody's been working home and everybody's been isolated in some way, but still feeling this communal sense of trauma. So we thought it was very important at DRNY to begin having important conversations and seeing how best we can not only help one another cope day to day and and have those conversations and really listen to one another and what each of our coworkers and colleagues need. But also, in addition to that, how we as an agency can serve our community even better. As the name implies, Disability Rights New York is all about people with disabilities and advocating on their rights for self-determination and legal access and every single right that anybody else is entitled to. What we wanted to do better and to learn more about was serving the whole person. How do we do that? We did eventually create something called the Committee on Advancing Racial Equality within our organization. We really put it to every single employee here at the agency to do the work that it takes to learn about intersectionality and how race, sex, gender, prison systems, etc., how all these systemic identities affect people with disabilities. And by learning that and by absorbing that information, how can we use that to better serve our community and to serve all people with disabilities in their entirety? So that led us to seek out other initiatives, as you mentioned, Jeff, because we weren't, again, doing this all in the vacuum. We were not the only ones having internal conversations. How can we help? How can we learn more about this? And what is my part in this struggle to move forward in dismantling racism and all of the systemic effects it has? So one thing we did do was we did identify the New York State Bar Association, NYSBA for short. They were just pulling together an important task force called the Task Force on Racial Injustice and Police Reform. And I sit on that currently, and I do represent Disability Rights New York. We've been at work for the last several months, almost a year now, in doing some important research and important work to pull together our own report and our own recommendations. One thing I can say is that I've certainly learned a lot from the good people that sit around us at the table at the task force. We are all attorneys, as you might imagine, being part of a bar association. However, many of the members are involved in the criminal justice system in some way. So, for example, we have judges on the task force, we have prosecutors, we have defense attorneys, defense counsel on there as well. We have former police officers who have become attorneys since leaving their field of work. And we have various nonprofit and legal aid attorneys as well who work with advocates in this area. The different committees that the task force makes up really gave me hope in terms of how robust of a conversation we really were going to be able to have in doing this work and making sure that I was very informed from the legal perspective on what our report and what our formal recommendations will look like. Our 5 committees are related to subjects such as legislation, prosecution, community review boards or CRBs, as you may have heard about, as well as a committee called police misconduct, which I sit on, and also the committee on recruitment, monitoring, and training, which I co-chair. So all of these committees are really pulling together. We're in the drafting stages right now of pulling together all of our recommendations across the board. I think there are about 20 plus of us on the task force. So as you can imagine, it is an endeavor. It is taking just a little bit of time to pull together, but I can give you just a sense of what some of these recommendations are going to look like. And I will say before I go into a couple of those specific recommendations that we're working on pulling together, they don't exclude in any way any of the conclusions that were come to in the report that we're discussing tonight that was written in collaboration between DRNY and John Jay College. In fact, we think that many of these recommendations will be in support of the literature that was created within the report and vice versa. And what I can say about the recommendations at this point is that we have some recommendations that involve adding consequence to police who don't use their body cameras, right? Many don't know kind of what Therese alluded to earlier was that, you have data on areas and you focus on what you care about. You have data on things that you measure. What we found was that though there may be policies what have you that call for and mandate police personnel to use body cams in all situations, we obviously know through hearing of public events that that's not always the case. But what happens, we asked ourselves, what happens to those officers who do turn off their cameras or who fail to remember to turn on their cameras, etc. Some recommendations are related to those, really adding consequence and really bringing about just, it's not just a good idea that you do this, but here's why you should, and providing incentive to not kind of push that aside as something that you should be doing while you're in the community and while you're on the street and walking your beat. Another thing we want to do in our recommendations is speak about the community review boards, CRBs, and how best to make sure that they are empowered and provided with autonomy, transparency, as well as access to information that needs to be accessed by a community that is reviewing. In hindsight, many of these police incidents, many of them are across the board, are not equitably maintained. One district or one precincts or one area's CRB might be very small and be very insular, while the other may be larger, but there's not much organization there. There's no transparency. Not everyone knows what's going on all the time. We're putting in some recommendations into our report about what that looks like and how can you best empower these folks to do their job. We're also recommending very important training take place, which is something called bystandership training, meaning that we're recommending that officers be put through a particular training that not only puts the onus on them as individuals to act within policy, protocol, ethics, etc., but also puts the onus on them that if they see a partner or if they see a fellow colleague, whether on the job or not, acting in a certain way that is against that training and against those morals and ethics and their philosophies at work, they're trained as bystanders in such a way that they can actually feel confident in calling out their partner and saying, this is not how we do things, or can we approach this situation in a different way? We find that based on our research and interviews, et cetera, police don't always feel that comfortable in calling one another out when they see wrongdoing or misstep in policy or practice. And we really are encouraging the police community to consider that type of training. Those are a few major highlights. I'm happy to talk more about it in any of the following Q&A, but I certainly don't want us to go over time. But I hope Jeff that spoke a bit about what the recommendations are all about and the type of work that can be done, hopefully, to bring more transparency and more progress to the area.
Yes, absolutely. And you've done me a solid again in transitioning right into the Q&A. So I appreciate that. And in looking at some of the things we wanted to cover there, or circle back around with some of the earlier speakers. So one thing I'll say is I don't think we have a Q&A box set up, but if people want to add questions just to the chat there, I think that that function is available to everybody. And then we can bring in some questions from the audience. And so, but I wanted to circle back to Rakia on one of these pieces that I had. So there's a lot of different things happening, and so we just heard about the variety of things that just one task force full of mostly lawyers thinking about the types of reforms that are needed, and I wanted to just name a few of the other things that are on the table right now. So the 911 diversion plan that is going to be directing 911 mental health emergency calls to EMTs and mental health clinicians in 3 precincts in East Harlem, right? That's supposed to be starting this year. There's a lot of conversations about how we can get the 988 number implemented nationally, and something that has been implemented locally in other jurisdictions. Both of those focusing on the front end of just how are we triaging and sending different folks in response to calls from, as we heard, sometimes family members just calling on to get access to services for their family. Obviously, just last week we had the mayoral plan from New York City, and all the jurisdictions in New York State had to submit these plans to the state, or the executive branch had to develop these plans, and the local city councils and other legislative bodies had to approve plans so that they would not lose out on funding. And that was in response to an executive order at the state level. So we've got another 200-page plan that just came out from the city for us to sift through. And then city council, not to be outdone, had passed a resolution with 5 areas that they felt needed to be focused on within this context, including, as Erica alluded to, transparency, representation, diversity within the force, highlighting also efforts to decriminalize poverty generally. So Rakia, my question is this: as we see so many different policy initiatives flowing out, and there are so many different convenings happening, or other stakeholders pushing certain initiatives, how do we ensure that during these conversations, and even more so during the implementation of these new programs and policies, that we can hold on to the importance of intersectionality that you were highlighting earlier? And so how do we maintain that, not as a side conversation, as Kevin was mentioning, they'll get 1 day of training on this, and the other 90 days of training don't mention race or mental health at all, often in our training programs. So how do we weave the intersectionality conversation into the development of those policies and programs? And then how do we focus on implementation with that lens as well?
That's a great question. So I don't think there's any definitive answer on how to incorporate intersectionality. I think that even though the term has been coined, it was coined a really long time ago, I think that people tend to really struggle with thinking in those terms. So understanding that people's identities do occur in an interlocking capacity rather than a single capacity. So someone's not experiencing something just because they're experiencing mental illness, or because they are Black, or because they're identifying LGBTQIA+. If someone identifies with all of those things, their experience with the world is happening as an interlocking method, like in an interlocking capacity. And so when policymakers do draft these policies, when EMS arrives at the door for someone who's experiencing a mental health crisis, these people have to already be considering their own biases for each group that they have. They have to be considering how their biases impact the way they interact with these groups, how how society kind of views these groups if they're making policies, and just understanding that it's something that is within that's causing their reaction to the person, not the person themselves. And so I think that, there are these trainings that we have, there's that one diversity day, interweaving diversity throughout the entire training, intertwining diversity throughout any type of professional training is like really integral to creating a safe space for people who are in need of services, but tend to be really hurt by these services that they're receiving. And so I'm not sure if I answered your question. I think Dr. Nadal could probably answer that better because he has conducted these trainings.
No, that was great. I mean, I think the finding ways to make it part of the ongoing conversation is part of the challenge, but an important one. Kevin, did you have anything to add to that about ways that, and perhaps maybe to think about the second question? And I know it's again a challenging one. It's a big issue, but how do we maintain a focus on racial equity on intersectionality lens through the implementation of a new program. And that's something that I've experienced, certainly, where we have a very rich and diverse conversation about the problem as it's presented. We're able to develop a plan that we think is going to respond to many of the issues. But then when it comes down to implementation, it's kind of laser focus on the key things that we think we can change. And then the other things that are somewhat newer to us, somewhat less comfortable, maybe we feel we have less control over, are pushed aside because we're focused on specific outcomes that are maybe more traditionally police oriented or social service oriented outcomes that we see.
Sure. I want to just echo what Rukia started with, which is this idea of individuals doing that self-reflection, understanding their biases in every single thing that they do. I want to just also acknowledge that this is not just a police thing. This is something that we require or heavily suggest for people of any profession to do. Psychologists have to undergo training in which we look at our biases and how it affects the ways that we interact with our clients or our patients. Teachers have to do that self-reflection. I hope other fields do that as well. And so asking police to do this is simply something that we are asking everyone to do, because we understand that we all have been socialized to have certain biases, not just about other groups, but even within ourselves of what we believe to be good or bad, what we believe to be positive or negative. And those are things that we have to work out because we know that they have a negative impact on how we interact with other people. I think when we think about that individual level work, we also then have to think about how can systems put that into play, or how can they encourage people to do that. And so I think there needs to be an overhaul of training systems where every single thing that people do, you have to revisit and center anti-racist pedagogy, as well as just intersectionalities into everything that they talk about. You can't have a conversation about tactics without also having a conversation about implicit bias. You can't have a conversation about just basic communication skills or de-escalation skills without also thinking about cultural competence and cultural humility and how your cultural identities influence the ways that you interact with folks. And so I think from a systemic level, something that needs to be done is to make sure in policy, in writing, that those types of integral pedagogies are made part and centered of everything that people are teaching. I also think, again, I'm going to go back to defunding the police. I know people are uncomfortable with that conversation. At least I'm not saying abolish the police, because I know people are way more uncomfortable with that conversation. But I think that this is something that we need to think about. If we know it's not working, why are we going to continue to do it? I still think that police, even if we don't let them be the first responders to working with mental health issues, they still need to do their implicit bias training. And I shouldn't say implicit bias training because we know that that itself isn't as effective, but their cultural humility training or their self-reflection on all their different identities. I mean, I think that's something that that needs to be done. And then I also think that we need to remove it. And so to your question of like, when we do create these programs, how do we center the conversations? We make sure that on day one, when we're creating as communities, whatever programs we think will fit our communities, that we're centering conversations on race specifically and other intersectional identities, that it has to be at the front of the conversation, at the top of the agenda. It can no longer be an afterthought. When the people create things in this country, especially through systems and policies and legislation, intersectionality and racial justice is always an afterthought. And that is because the people in power historically have been white people, white men who want race and intersectionalities to be an afterthought. So we have to change that. And especially for people who are in power, to change this colorblind ideology that does not exist. We have to name things that are truths to the ways that we operate in this country. I don't know why people have such a difficult time talking about slavery and genocide when our country is founded on slavery and genocide. They need to teach this in our schools. They need to teach what Rukia talked about in terms of the history of systemic racism in police departments. And if police officers then say, well, then I don't want to do this job, well, then maybe they don't need to do this job. And we need to find people that actually do want to be effective, people who can work with people of all communities and check their biases, and understand that if this is the field that you're choosing, that these are what the new requirements are. And this is how we're going to be most effective in keeping communities safe and keeping communities feeling like that they can walk around and live their lives. So again, I think centering, naming these things, making it something that people are comfortable in talking about. And also, like, the last piece is I think it's time that we continue to always hear statistics, and those statistics will always be really important. But we have to talk about emotions. Like, I mean, I think just one thing that I was sitting here listening to is that we're talking about this so academically, which is what we do as academics, right? But it's not just academic. People are hurting. People are hurting right now. People are watching this I shouldn't say, it's not the George Floyd trial, even though the media is portraying it that way, the Derek Chauvin trial, and are hurting because this is historical trauma. It's not something that a statistic can even address, because statistics and science are being dismissed, and people aren't listening to those things. And so maybe if we actually hear the stories and the pain and the hurt and the qualitative experiences of communities of color and other historically marginalized groups, that people might actually at least care. And if they don't care, at least they're being honest. And I don't know, but this is just where I'm coming from right now. I'm on edge because of everything going on in the world. And I think we need to have more real conversations about it.
Jeff, I wanted to talk about where our lawyer's coming from, who in the context of the report. Do you mind to pick up right where Brother Nidal left off? Because I want to say, preach, Brother Nidal, preach. Thank you very much for that. Do you mind?
Please do. Go ahead.
Well, there's a couple of there's a couple of elephants in the middle of the room relative to training that are borne out in the report. And I thought that was something that is worth, highlighting. One of them is that training of police officers who are now working in some sort of a group response that is geared to de-escalation and things like that has not, according to the data, stopped shots from being fired and people from being killed. So we have to look at why that is. And a couple of things that I think really need to be considered are that the training that is being given is not being given under the right circumstances. As Kevin pointed out, who used to do the work, you're teaching young officers in the academy about de-escalation or even with a certain cultural competence component to it. But then those folks leave the academy and they go to an entirely different culture where very different messages are being said at the precinct level, in New York at the NYPD level, so that it's really hard for those initial training messages not to be lost and replaced. And then when we try to update them, police departments say to us, well, you can't take folks off the street, so we're going to try and do it, in the 15 minutes at the roll call or in some, questionnaire that they answer or something. And that's just not realistic. And are the people that are doing the training the right people? Or does looking at more of a multidisciplinary response to this that makes sure that all of the people that are impacted are doing the training and contributing the training make more sense? And the other thing that really I think we can't help but avoid saying is that it needs to be constant. It needs to be whoever makes up the teams of people that are going to respond under alternative models have to be people that are consistently being retrained together so that everybody's on the same page, right, about what their mission, their group mission is. And it also needs to incorporate what is learned in the process of this new model playing out. things that we might have gotten wrong at first that need to be tweaked. And all of these components of training don't seem to be being addressed as far as I've seen yet in some of these other proposals. The need for continuing comprehensive training under the right circumstances doesn't seem to be being built into the models. And I think that's something that we need to call for.
Yeah, and so I'll speak a bit about some experience that I've had in working with police departments in different programs and retraining on that front. And so one is that, and I think actually one of the other members of the panel shared this documentary that's out called Ernie and Joe, Crisis Cops. And so that was one of the groups that I was thinking of. There's at least 2 officers in the country who are getting this right. But in the documentary, they talk about the challenges that they have and that they're unicorns within their own department. And that, many an anecdote where they show up to a scene where, some quite similar to what we've experienced in New York City, where people are barricaded in their apartment or barricaded in a room within their apartment and have a knife or a weapon and are threatening self-harm, and then end up being harmed by the police as they attempt to engage this individual. And so, it's, and I posed a question to one of the individuals. We had a short screening a couple months ago and a panel conversation with Ernie afterwards, and asked him why is this still such a challenge? And he indicated that many of the modules within the police academy really impact the young officers in a way that they come out of the academy fearing the general public. They are shown video after video of officers being assaulted by members of the public, of people being ambushed, as we had one of those incidents not too long ago in New York City, where the man traveled up from Washington, D.C. and walked up to a cop car and shot a cop in the head. And so they bring these as protect yourself reminders. But he said the impact of the repetition really has on the psyche of many of the officers is they come out scared, they come out jittery. And they may have entered the academy feeling like they wanted to join a helping profession, and they leave the academy feeling like they are really at risk and threatened. And so it's in this context that then they are responding to emergency calls and going out on the dispatch. And so recognizing that, we almost have to redesign training of police, particularly in urban spaces, from square one in the way that we are engaging them and preparing them for their work. And one of the ways this manifested, I'm just inserting myself as a panelist here, I apologize. But when I was running one of the programs where we were trying to reduce the arrest of homeless individuals on the subways, many of whom were sleeping on the subways overnights. And in the cross trainings that we did between the homeless outreach workers and the police department, one of the things we talked about is that homeless outreach workers would look at people's feet first, because on initial encounter, they could tell a lot by the condition of someone's feet what their general health was and potentially even what their mental capacity was. And we've all seen these people on the trains, those of us who ride the trains, who still do, even in the time of COVID. We've seen folks who are on the trains who don't have shoes, their feet are very dirty, or they have big swollen ankles, clearly in need of medical attention. And that's the type of thing where the homeless outreach workers are really going to engage that person. The police, when they encounter potentially the same individual, are looking at their hands, because the hands are what can hold a weapon, and that can be used to create harm. And so just the initial encounter and the assessment of the individual's wellness or potential behaviors or potential next steps is entirely different depending on the training that we provide to the two disciplines as we were doing joint patrols in the subway. And I'm happy to report we were very successful in that. We almost eliminated and certainly drove down arrests of homeless individuals on the overnights. And then city council actually changed the rules, so you couldn't arrest people simply for sleeping on the subways. And we had created the solution to the problem there for PD. And so they were able to utilize that moving forward. But the last piece I'll say too, you mentioned about roll calls. I think with repetition, using roll calls can be effective because it's one way of just getting in the face of officers. And so in other pre-arrest diversion programming that we've implemented, going out and doing roll calls. Hey, remember, this thing's back on, particularly as the economy opened up after COVID and we saw the arrests start to increase again. We just had to go back and remind people like, hey, here's the program. Here's the phone number to call. Someone gets arrested for drug possession or petty larceny. When you get finished with booking, it's call the DA's office on this number. We're going to send a peer out to engage them. And so there's an opportunity to engage different protocols and processes there that we can certainly take advantage of. And we've got to sort of grab every advantage that we can. So I haven't seen, I was somewhat responding there with my own stuff because we haven't seen questions in on the chat function there. I certainly encourage those that are here to speak up if you have a question. But I wanted to go, Erica, I wanted to go back to one of the pieces that you mentioned earlier about the work that Disability Rights New York has been doing and kind of recognizing that you're all having this conversation within your organization, and then that many other organizations are having these conversations concurrently, and obviously going out and getting involved in a task force was one of those strategies. What are some of the other ways that you all are thinking about being part of a larger conversation or facilitating a conversation yourselves with a larger group of people? Well, how do we be, widening our audience for these types of conversations as we move forward on these issues?
Thank you. That's a really great question, Jeff. And what I'll say is everything that all of my colleagues said, check, yes, all of that. One of the things that one of the panelists already alluded to is the fact that there is no easy answer to all of this, right? There's no one way to work in interdisciplinary approaches or intersectionality or certain pedagogies and certain strategies, et cetera, because there are so many moving parts to everything. Right, something that my dad always says is that when you're on the road and you're driving, right, you're not just worrying about you and making sure that you drive well and that you're driving safe and that you're not passing the stop at the stop sign or the red light or going too fast. You've got to worry about everybody else around you because everybody else is driving too, and it is a metaphor that I've taken kind of in the back of my mind, that we're all moving perhaps in the same general direction in the same 3 or 4 lanes, but everybody's coming from a different place and everybody's hoping to get to a different place, right? And the different ways in which that, you mentioned academia versus law enforcement, et cetera. We're all coming at it from different places. And I think one of the best ways to start expanding the conversation about all of these important initiatives is really starting where you're at with what you have, wherever you are. Start with what you have. What don't you know? What more do you want to know about your colleague or the news event that you saw, perhaps even live, the riot from January 6th comes to mind. What more do you need to know about what's happening? Why are these things happening? Why are these things happening to some people? Why are some folks with certain beliefs driving one particular approach to something, whereas another group of folks perhaps are going into another direction? Self-education is really so important in all of this. And again, I'll emphasize the fact that there's no easy answer, and none of us knows the answer for everyone, because as Rukia said, because we're all coming from different backgrounds, because I am a mixed race Latinx woman with disabilities, I am coming from a different place to the same problem or the same situation. I'm coming at it from a different place than my colleague Katrin or my colleague Tim or anyone else is coming at it from. But so, as much as you are unique in coming at it, again, you got to remember everybody else in the lane. Not everybody else is going the same speed that you're at. Not everybody is going to be driving the same way that you are. It is so important still, though, that even when you meet barriers or pushback, or maybe you're feeling as though you don't even have a role in some of this conversation, the fact is that you do. So I would encourage anyone who's listening to a panel like this and others like them, that if they want to help folks who are in mental health crises, perhaps avoid, the police brutality, or perhaps, be diverted toward mental health resources as opposed to something else, learn about it. Ask a person who has mental health issues and barriers, what is it like? Talk to your neighbor, talk to your friend. Something that was already said is that emotions matter so much in all of this. The rules of the road absolutely apply while we're all driving toward whatever place we're going. But in the meantime, the person next to you may be very traumatized by driving. The person who's in front of you may be distracted while they're driving. The person behind you may have a car that's totally falling apart and they're worried about getting somewhere on time, and they're stressed and they can't be bothered with focusing on other things right now. And that perhaps makes it a dangerous person to have next to you in the road. So I would just say that everybody's got a role in all of this. It is important that we come back over and over and over again to this type of conversation. My friend Mark mentioned coming back and reasserting certain training, but also coming back and reevaluating that training over the long haul. It doesn't take just one day of training for any of this to change. And that will never be the answer. It's coming back again and again and again, even when you don't think you have a place, or even when you don't think you have something to say or something to learn, knowing that you can be humble enough to understand that you do. That's really the most important part in all of it.
Well said. Well said. Although you triggered me a bit about the driving. I got pushed off the road by a truck one time when it was raining out. And it took months for me to be able to drive in the rain again without just being entirely fearful.
I'm sorry, I had no idea, Jeff.
No, it was just the emotions of driving was true with me. So Teresa, I wanted to come back with you because I was reading through your bio before this, and I know that before you were doing the kind of broad jurisdictional analyses of uses of force and things like that, you were looking also at just implicit bias within criminal justice and mental health intersections generally. And so I was hoping you could speak a bit to kind of the ways in which that implicit bias manifests, or at least what we know about the ways that manifests, and how efforts to address implicit bias within both mental health and criminal justice contexts, how kind of those sectors might learn from each other, or how we can take some successes in one field and bring that into the other.
Yeah. So one thing I'm really interested in is our beliefs and biases towards people who have mental illness, and what that might look like in police officers. So I think we already touched upon that officers have biases towards persons with mental illness. Dr. Llanos actually did one of the few studies that exist on it, and found that biases towards persons with mental illness among police officers was more pronounced than in the general public. But no research yet has looked at implicit bias, as far as I know, implicit bias towards persons with mental illness amongst police officers. As Dr. Nadal mentioned, when it comes to implicit bias training, there really isn't a lot of good data on that. And so although I think, in the past, departments have looked towards implicit bias training when they've had incidents in their own departments as their way of addressing it. But as we've all talked about here, it stops at that. And that's not enough. And I think in particular, it's not enough because this isn't just an individual problem, it's a systemic problem within police departments and within policing culture. So I'm hoping to expand my research a little bit to still look at what attitudes look like amongst police officers, but also how larger structural stigma measures are impacting potential outcomes as well. And ultimately, if we're finding that officers have more negative attitudes towards persons with mental illness, stronger racial biases, the culture is not conducive to positive outcomes, I think it comes back to we need to look elsewhere. And at the same time, as Dr. Nadal mentioned, even if police officers will no longer be the first responders to mental health crises and other, social issues, they still need to be educated and continue to receive this training and this work, because it's all whatever solutions that are developed and implemented, officers will still continue to come across these issues as long as they're on the streets. So I think it's a tough solution, and there is no one solution that can really address the issues we're seeing here. But I think we need to look towards a lot of different areas for figuring out how to reduce these really terrible consequences that we see.
Excellent. Thank you for sharing that. And so I thank all of our panelists who joined us today. We are approaching our end time, so I want to just again thank Rukia, Erica, Kevin, and Therese. And I'm going to toss it back to Mark and Tim for closing thoughts.
Well, I'm going to toss it ultimately to Tim, but I just want to thank John Jay for the collaboration. And not only in the context of the report, but also in the context of this panel, which we hope, frankly, is the first of many, because there are so many other good voices to be heard on this issue. And with that, I'm going to turn it over to Tim to really close things out.
So thank you, Mark, and thank you, everyone, for the commitment that is clearly demonstrated here tonight from all of you. And not just from the panelists, but also, we have 30 people attending this event tonight. So I am encouraged, because other than the panelists, and now it's like 27 other people who were not aware maybe of all the issues that we've touched upon here. DRNY is the New York PNA, the Protection and Advocacy. It's a big deal. And what we do is we have a huge responsibility, and we take it seriously. And, for our part, what we are doing is we're making sure that we are deliberate in the cases that we take, the investigations we do, and that we are looking for the intersectionality between, our clients and the demographics that play a part in this, and why disproportionately our clients of color are being harmed. So it is our goal to make a difference, and to that end, there need to be consequences when our clients and the people we care about are injured and killed. And it is my hope that this report will move things. This issue has been around for a long time, but we're not going to stop bringing it to the forefront and screaming it from the top of the mountains when we have to. So I am honored to be in the presence of all of you, and I really appreciate your commitment to this issue.